When sharpening your hygiene instruments, there are several techniques to follow. Maintaining properly sharpened instruments decreases the chance of clinician hand fatigue by creating more productive strokes and reduces chances of burnishing calculus. Clinicians should also be careful to not over-sharpen, as this thins the blade, making it weaker and potentially unsafe to use. Things you need: sharpening stone and plastic test stick. White side is super fine for polishing or daily touch-up after use. The blue coarse stone sharpens excessively dull instruments or recontouring of blade not for daily use. Sharpening guide is also needed, universal, area specific, and sickle. Full PPE is also needed. While wearing personal protective equipment, which includes eyewear, the clinician should position themselves at arm's level by a countertop. While sitting or standing in a stable position, the clinician should utilize the sharpening guide to position their instruments. Each type of instrument has a different angle of blade, so it is crucial the clinician sharpens at the appropriate angle to maintain the integrity of the cutting edge. The sharpening stone is to be held firmly with the dominant hand toward the blade at either 11 or 1 o'clock. This is shown as 110 degrees on your sharpening guide. In your non-dominant hand, firmly grasp the instrument with the face of the end you are sharpening looking up at you. Instrument and angle is determined by the type of instrument you are sharpening. Starting at the heel of the instrument with short controlled movements, run the sharpening stone up and down the cutting edge of the blade, moving forward to the toe of the instrument as you work to ensure even sharpening. For the sickle scaler at 90 degrees, in your non-dominant hand, position the face of the instrument parallel to the counter. This makes the lower shank perpendicular to the countertop. In your non-dominant hand at 1 o'clock, using short controlled strokes moving from the heel to the toe, then at 11 o'clock, use the test stick to check for sharpness. For the universal curette at 90 degrees, hold the instrument with the face parallel to the counter with the lower shank perpendicular to the counter. With your dominant hand, hold the sharpening stone and with short controlled strokes, start at the heel and move towards the toe. For the finishing of sharpening, round out the toe with your sharpening stone. For an area-specific curette, such as a Gracie curette at 110 degrees, after testing for sharpness in your non-dominant hand, firmly grasp your instrument with the face parallel to the countertop. The lower shank will not be perpendicular to the countertop in this case. Then with the sharpening stone in your dominant hand, use short controlled strokes, starting at the heel and moving towards the toe. Test for sharpness. When finished, make sure that the toe is rounded out.